Now, operatives of the National Agency for Food and Drug Administration and Control have uncovered what it describes as one of the largest fake drug warehouses ever discovered in Nigeria. Millions of doses of dangerous, banned and counterfeit medicines capable of killing millions were found inside a warehouse at the Lagos Trade Fair complex. The director of NAFDAC Lagos State Command says the operation has saved the country from a major public health disaster.
We have injections from different companies. We have sachet products. We have blisters. All of them very, very important medicines. We have some banned products that have been banned for over 15 years. Quite frightening at the kind of quantity we met is enough to send more than 3 million Nigerians to their grave.
Let's talk to pharmaceutical consultant Hakeem Oshiemi, who joins me on TVC News at 10. So Oshiemi, thanks for joining us this hour. From a pharmaceutical safety perspective, what do you consider to be the real dangers of fake and banned medicines on this scale, especially injections and anti-malaria drugs, and what kinds of harm could they cause before anyone even realizes something is wrong?
Thank you very much. Good evening, and thank you very much for having me. The question you asked, first of all, I want to commend the NAFDAC team for a job well done and for this particular intervention. And like the director said just then, this could be a catastrophic situation for the country if it wasn't, if they didn't discover this. So this is a very good intervention by NAFDAC, so they must be commended for that. Because fake drugs, for me, actually should be treated as terrorism, because the victims do not necessarily know the impact of what's going to happen to them. Fake drugs are often doesn't have the actual product in them, actually does more harm than good to the patient, and actually end up killing the patient rather than saving them. So this is a very important intervention.
You know, the fact that over 10 million counterfeit drugs were stored at a major commercial hub like the Trade Fair complex raises serious questions. Where in your assessment are the biggest weaknesses here?
Yes, absolutely. The fact that this has happened and we've been able to catch a large amount of counterfeit medicines is a very important development for the country. However, I think we need to do a lot more in terms of securing our supply chain. Actually, when I say securing our supply chain, we need to overhaul the entire supply chain. If I give you an analogy here, it's like having a large house with multiple holes in the roof, and you go, every time it rains, you carry buckets to try and catch the water. While it's good that you've been able to celebrate being able to catch a large sum of leakages here, what we need to do is to prevent introduction of fake medicines into our supply chain in the first place. Again, that's not an easy task, but because like anywhere else in the world, pharmaceutical supply chain is a very complex, multifaceted issue that requires careful coordination and taking part of all the stakeholders in the pharmaceutical and healthcare industry. And there are a number of things we can do, and if I just touch on the four of them, the four that I think are the most important. The first thing we must do is secure our supply chain. We need to overhaul our entire supply chain. We need to understand our pharmaceutical supply chain and then understand where the weaknesses are, where the fake drugs are entering the system, and then plug those holes. Mm-hmm. The issue of having open markets, for example, is a big issue that we need to resolve. as an example. And then the second thing that we then need to do is to make sure that we back that up with technology, to make sure that first of all, we are able to prevent fake medicines entering our supply chain. And if we do have fake medicine entering our supply chain, we're able to detect it very quickly before it becomes an issue that to the healthcare professionals.
You know, calling 10 million. Yeah, let me just butt in quickly because of time. Calling 10 million doses large is relative to the number of fake, drugs out there. For Nigerians watching tonight, how likely is it that some of these fake medicines had already found their ways into pharmacies and hospitals?
I mean, it's not a matter of whether it is likely. We know we have an issue with fake medicines, falsified medicines in the country, like much of systems where the supply chain is not robust. That's why I'll keep on talking about the need to overhaul our supply chain. Yes, it's a big issue that we have. Can we put a number to it? The answer is no, because lack of credible data is an issue, which is another thing I want to talk about. How do you know you are improving if you don't have open and transparent data that you actually regularly monitor and review? So yes, to answer your question, it's a big problem that we have, and we must take a systematic approach to it, to actually not just looking at catching it at the end, but actually preventing it from happening in the first place.
NAFDAC describes this as a huge success, but it could also be pointing to a deeper systemic problem in drug regulation and enforcement, which is important that we start paying attention to. That's our time. Pharmaceutical consultant Hakeem Oshiemi, thank you for talking to us on the news tonight.
Thank you very much for having me.